Let's talk about pathologic gambling. Mike, a 40-year-old married man and father of two, was fired from his job because of embezzlement of company funds. He disappeared with the company payroll cash. When found, he did not have the money on him and admitted to losing it while gambling. His wife left him 2 months ago, and he has not seen his wife or children since. So what Mike has is a severe problem with gambling, where you have persistent and recurrent gambling behavior that includes a preoccupation with gambling, a need to gamble with more money, attempts to stop gambling and or to win back losses, illegal acts to finance the gambling, or loss of relationships due to gambling. If this were not gambling but a drug, Mike would probably have a substance dependence. So pathologic gambling is sort of the equivalent of the dependence diagnoses that you see in drug. It affects you in the same way. All you do is think about the gambling, all you do is want to gambling, and it affects every single aspect of your life. You're going to find more of this in men than women. A lot of times you see increased risk for alcohol dependence in these patients as well. You could, of course, have poor parenting as one of the causes. You could have exposure to gambling behavior, and of course, any kind of divorce. So these are the things that when these kids are growing up could be the risk factors for them to have gambling in the future. It could be linked to mood disorders, also OCD, panic disorder, agoraphobia, even ADHD. A lot of times these individuals do not have the money to gamble, so what do? They might engage in antisocial or illicit acts in order to get the money. They do appear overconfident, and they do have a lot of suicide attempts. And if we think of suicide, one of the states with the highest rates of suicide is Nevada, and everybody knows what Nevada is known for. And because of all their illegal activities, many of them could have multiple arrests and or incarceration. The treatment of choice for patients who have pathologic gambling would be Gamblers Anonymous, and pharmacotherapy probably directed at helping them control the anxiety that is associated with gambling. But if given a choice between GA and pharmacotherapy, the treatment of choice here, hands down, will have to be Gamblers Anonymous. And reviewing again the psychiatric differentials for pathologic gambling will have to be mania. But remember, in mania, you don't gamble every day. You would only gamble during certain periods when the patient is manic. So there would be more of an intermittent episodes of gambling in the manic patient than you would in the regular pathologic gambling patient. And as far as antisocial, not only would the antisocial gamble, but they would do other kinds of antisocial activities. So it is more of a bigger picture of the antisocial behavior than only focusing on the gambling. So those are the two that would be the biggest differentials from the psychiatric point of view.